Hello, my name is Iara and I'm going to talk about prevalence of increase in adolescent obesity. First, let's see what is adolescent obesity. Obesity in general means excessive fat accumulation. So, adolescent obesity is when this condition occur in children aged between 13 to 19 years. So, what is the definition of overweight category? This is when BMI for age ratio is greater than one standard deviation, while obesity means when this ratio is greater than two standard deviation. Now let's see what overweight and obesity means in relate to percentile. Overweight is when BMI is in between 85th percentile to 95th percentile, while obesity means when this is greater than 95th percentile. Now let's talk about the risk. Approximately 1 in 7 Canadian children and adolescents are obese. Obesity prevalence has not changed significantly since 2007. Therefore, this rate is expected to remain pretty much stable for the next 2 decades. Now let's talk about the effects on physical health. High blood pressure, complications in growth and pubertal development, type 2 diabetes, bone and joint problems, reduced balance, menstrual irregularities, liver diseases, and also breathing difficulties and sleeping apnea. Other than that, hyperinsulinemia may also result. What is hyperinsulinemia? It is a condition where insulin level in blood is high. It's a normal physiological condition during puberty, but children with obesity can have abnormally high insulin level. Further, leptin production by the adipose tissue will also increase. Elevated levels of leptin and insulin will ultimately result in bone age advancement. So these are the obesity related comorbidities: cardiovascular diseases, hypertension, type 2 diabetes, hormonal issues, then orthopedic problems, sleep apnea, asthma, fatty liver, and many more. Now let's talk about the mental health. Earlier we discussed about the physical health. Now let's talk about mental health. There's a very high tendency of adolescent with obesity being getting bullied, feeling judged, then low self-esteem, depression, anxiety, poor body image, like that. This is about factors influencing adolescent obesity. This diagram shows multidimensional factors contributing to childhood adolescent. It is a combination of individual factors, then socio-economical factors, and then community factors. In individual level, it is basically the genetics and eating behaviors that can cause in weight gain. Then socio-economical and community factors could be the influence of families and community. Next, biological factors. This could be increased appetite due to psychiatric disorders, stress, sleep-wake cycles, then also genetic factors. That is when mutations occur in leptin gene or leptin receptor. This leptin gene is the gene that controls food intake, body weight, and energy metabolism. So when mutations occur in this, it will ultimately result in childhood obesity. Next, we'll talk about developmental factors. Eating habits learned from parents and preschools can affect. Then, providing large meal to the children and large food portions and encouraging them to eat them in full. And also in schools and daycare centers, they may expose to different food options, but the physical activity is very limited. Further, impact from sedentary behaviors such as playing video games, increased computer use may also have an effect. Process of examination. There are healthcare clinics in multi locations. To locate the closest clinic, it is possible to Google search it with the help of the postal code. Then the adolescent will be assessed once the adolescent reach a healthcare clinic. They will be assessed and then treatments will be provided. Next, parental control. Parents and children interaction will create an impact on child feeding habits. Like parents has the ability to force them to eat something while restrict some food. So if parents doesn't put 100% effort in preventing child obesity, treating it would be very difficult. Further, constant motivation and dedication is also really essential. Dietary interventions. Make them eat more fruits, vegetables, whole grain products, and also encourage them to take more water. Then replace milk from low fat, non fat milk, and also other dairy products. Then choose lean meat, poultry, fish, beans for proteins. Limit consumption of sugar and saturated fat. Exercises. The easiest activity for obese individual is walking. Walking can increase up to 12,000 steps a day. Other than that, 2 or 3 sets of weightlifting exercises for a day or 2 in a week is also recommended. Then counseling. First, child should be assessed. Then only the nutrition counseling is performed. The most successful method is monitoring a daily log of food and drink intake. So these are the resources that we have been used in creating our PowerPoint presentation, and here comes to an end. The target audience is basically parents and adolescents. Since use of technology has become an essential part of our lives, we decided to make the society aware of presence of adolescent obesity through an educational video. These are the references, and thank you very much.